Hey everyone, today I'm so excited to have on YouTube Dr. Alyssa with Move to Learn Physical Therapy. Alyssa, welcome to this channel and tell us a little bit about, Move to Learn and yourself.
I am a school-based therapist, so I'm in pediatrics, but I work in the school. A little of my background, I started in a nursing home and worked there for only 3 months because I knew it wasn't my thing. So I didn't wait. I got out and I went into schools, and that is where I've stayed. So right now I'm in a special education elementary school, but I've been in public schools.
I love it. And I don't even know if the people of YouTube know that I was also a school-based therapist too. So I've done a lot of things in my career. My husband's active duty, and so that kind of forces my hands sometimes in different settings. But while I'm not in the school-based setting now, I did super love my time working with the kiddos there. There's such a variety of kiddos you get to serve and a lot of teachers and other paraprofessionals that you get to influence that can then help impact that kiddo's life. So Alyssa, what is your favorite part about being a school-based therapist?
It's different than any other niche. One of the reasons for me that I didn't really jive with the nursing home was that it was just kind of boring for me. It was kind of like the same old, and kiddos keep you on your toes. The school environment is its own thing.
Wild
So,
party.
yeah. So I just needed something that was gonna keep me a little bit more engaged in thinking, and even almost 7 years in now, I am still learning stuff every single year because there's just so many little intricacies within, laws and how different districts do things and how, this program does this. So I needed something like that I was going to be able to think through all the time and problem solve through. And so that's what
And
I
having
love
the
about it.
summers sort of off, I know a lot of times there's ESY or services
Hmm.
sometimes that therapists provide over the summers, but not a bad gig either. You need to calm down, get ready for the chaos that the new school year, which we're about there. So it is starting.
Yeah, that's obviously one of the main benefits is the schedule. I could probably never go back to another job because the amount of time that I just get off and I don't have to request off is
Yeah.
prime.
And it's super interesting too. We'll go a little bit off topic here from physical therapy, but just from a workload life balance management system, sometimes it's so nice to have those almost forced breaks in your schedule. So, yep, you have a little bit of time where you're, working up and then it gets busy and then maybe it slows down or maybe you have a break right away and then you're like, okay, I can calm down, I can do something, I have a little bit more me time, or I can go on vacation or whatever. And then it starts again and you work up to a certain level, but then you have another break. And so I feel like from a longevity standpoint, it really works as far as having a work-life balance. More of your work as a physical therapist can be a little bit more in seasons, which I think is just generally more natural for us as humans. So I do think, well, like any setting, there's going to be a potential risk for burnout and or kind of difficulties that are specific to that niche or that setting. I do think having a job with some of those pre-planned breaks within it can be really helpful for the long term.
Yeah, and even just the breaks, but okay, every 10 weeks there's progress notes. Every year there's this. So just the deadlines, knowing when, well, sometimes when things are going to be but I just love there's always something to look forward to. It allows me to plan things out and write things out and cross things out, and I really thrive
Are you a
with
list
lists
maker
and
too?
crossing things. Yeah, you write something on your list so you can cross it out.
My husband's like, what are you doing over there? And I'm like, oh, I'm making lists. He's like, of course you're always making lists. And
Yeah.
so I do feel like for someone who really thrives in organization or in kind of structured time zones, you do have to be a little bit of a self-starter in the school systems, because there is also, like, while there is structure, there's also a lot of latitude. Like, a lot of times you have to build your own schedule versus someone giving it to you and certain things like that. So sometimes, you have to be ethical, honest, organized enough to get yourself placed on time, and then also adapt so that you can then change when your perfectly created schedule conflicts with a teacher or a meeting, or a kiddo's gone and you have to complete a test or something like that.
I love that. I love puzzles. So that's like scheduling, and you're always having to like fit things in. I loved that I was able to go out and kind of be by myself most of the time, do my own thing. If you thrive on like being with other people and bouncing ideas off of them constantly, school setting may not be your thing, but there's other ways to get that if you're not with people.
There's going to be a lot of different, I feel like, people who might find this video, and some of those people might be parents who are like, oh, my child is receiving school-based physical therapy. And then the other people that I imagine are going to watch this video are either doctorate of physical therapy students, maybe individuals who are occupational therapy students, or new grads, PTs who are maybe they started in a setting and they're like, what else is out there? Or people who've been in the profession for a while and they've maybe had their own kids and that sparked a new passion for them. For me, honestly, I loved ortho, and then also had peds like kind of on the side, like was interested in it, but like not enough to give up ortho. Went to Alaska for a travel gig. They ended up being like committing Medicare fraud. I turned them into the PT board of Alaska. So scary, like so nerve-wracking, because we're taught so much about like protecting our license.
Good for you though, like brave.
Yeah, my recruiter, because it was a travel position, so he found something. He was like, it's outpatient peds, and I was like, I'll do it. I'm all in. If they'll be a little patient with me, I will like put everything into it. And honestly, I just had so much fun that I like never left.
I'm with you.
Yeah. So outpatient peds, school-based peds, early intervention peds, home-based peds, clinic-based peds, school-based peds, like all the little small children. It's a lot of fun. So regardless of what type of viewer you are, know that there's going to be something in this interview for you. We'll go through a bunch of different topics, but please stick around because I think that you will learn a ton from Dr. Alyssa. We talked about like how there isn't a ton of built-in time with other therapists. What is your advice to someone who's either been in the PT profession for a while and they're thinking about transitioning into peds, or they're a PT student or new grad who's like, I'm really interested in school-based therapy. I feel like it would be a really good fit for me, but I'm a little bit nervous because I've always heard that having a mentor is like the best thing possible, and I absolutely need one, and I'm a little nervous that this setting doesn't have that built in for me.
Yeah, I feel like that mentor thing is such a touchy subject. I don't know like where we get that from. I think it must be college. They must like tell us that we need mentors all the time. And it is absolutely like, yes, you want to be with people that you can bounce things off of. But it doesn't need to be a direct in-person mentor, right? Like you can find other people that you can bounce ideas off of, learn from, that they don't have to be like there in person with you. My advice to anybody who is, thinking about this tiny little niche, because it is so small, is to join, their school-based PT Facebook groups. Those can be helpful. I have an Instagram all about school-based PT. I have a course all about school-based PT. And then with that, you get a private Facebook group as well. Really though, my advice, what I'm trying to say here is find your people and they will lift you up and help you. And they don't need to be directly in person.
Right. And you want it to be within the area that you want to master, right? So if you're
Sure.
looking to become a school-based therapist, or you already are one and you're like, hey, I have a really specific case, or I just want to like learn from other physical therapists. Maybe I'm the only PT in the district. I've done that. And while the OTs are amazing and you become really good friends with them and you learn a lot of interdisciplinary stuff, and then also a lot of other things that maybe weren't covered as much in PT curriculum, you sometimes just want advice or ideas from like how another PT thinks, because our brains are now wired through school more similarly to other PTs. And so inertly we speak a more similar language. So you want to definitely have a group of people who are either learning or striving to be better versions of the thing that you want to master. Surrounding yourself with other people who have the same goals as you is definitely going to make the journey easier.
Just surround yourself with the people that you want to be with, that you want to be like, and then you're going to grow regardless.
We had a little guest lecture about IEP Mindset, which you can find in Alyssa's course. And one of her newest members was actually transitioning out of the sports medicine-based peds space and going into school-based therapy. And he had a couple questions just on some of the nuances of school-based therapy. And that is something that is really unique to school-based therapy, is you get in and some of the things like scheduling, what are even appropriate expectations to have in this job? Sometimes even your special education director is going to know some things that can help you, but it's not going to be quite to the level of another school-based therapist who has been a school-based therapist for 5 years, 7 years, 10 years, 3 years in a district all by themselves. They're going to have different experiences. And so sharing those in that group, and then also learning from Alyssa and some of her other things, like specifically, I would say one of the biggest pain points for new grads, or even just me in general, is documentation. Alyssa, can you talk a little bit about your course in documentation? Because I know that that's a struggle for even like our doctorate of physical therapy students at the university that I teach at.
Well, there's a whole module on documentation, note writing, goal writing, annual review writing, evaluation writing, a whole lot of very specific documentation when it comes to school-based peds. But what I will say is, in general, people are writing way too much in their daily notes. So that's where they're losing a lot of time in their day, is they haven't been able to streamline that daily note writing, because that's what we have to do day in and day out. If you get behind on that, then you really just kind of, it snowballs, right?
Yeah.
So if you are writing less, but what you need to be writing per the Medicaid guidelines, you're golden. And the main tip I give is, we are doctors of physical therapy, all of these new people coming out, right? We know how to, not all of us, but
we love you, everyone who has a master's degree and bachelor's degree who may be watching this too.
We're physical therapists. We know how to alter our treatment to be individualized to each kiddo, right? What we can do is use a very similar note, but write how we individualized that same, say we use the same game or puzzle or whatever it is.
Right.
Just because I use the same game for Johnny and Julia, I still individualize their treatment, and I can write that, but use the same base note. Make sense?
Totally.
So I think that that's where a lot of people are spending a lot of time, is writing an excess amount of things that they don't need to be.
100%. And I also think in school-based specifically is, interestingly enough, there's more of a balance between treatment time and documentation time and travel time in meetings. And so treatment time might not always be the biggest part of your day as it would be in some other settings. That being said, treatment time is kind of our bread and butter. That's where we feel the most efficient. That's where we have the most practice. So some of these soft skills that Alyssa is talking about, like organization, system creation, really having a system, or like almost like an English lesson, like you learn how to write a paper. That's going to be similar to writing some of your notes in order to increase your efficiency while still, making sure everything that needs to be in there is in there, making sure that you're collecting the data you need to collect so that when you go to write the IEP or the progress note or the reval, that, you're thanking your past self because they were so kind to you, because they put all the things in there that needed to be in there, so you're not scrambling trying to like rack your brain or spend all this unnecessary time searching for things, because it's all right there, because all along you had this system to make it easier on yourself. So then all of a sudden now you have all this brain power where you can do other things like scroll Instagram and look up Move to Learn PT and like look up all her creative exercise ideas. Because I don't know you guys, but when I'm slammed, like the last thing I have energy for is trying to come up with something new and novel and fun. And so sometimes that is a side effect of burnout or overwhelm, is just that like you get bored with your interventions, the kids get bored with your interventions, and all of a sudden no one's thrilled with the situation.
Yeah. You made a good point, is like when you come up with systems in which you can be efficient in your day, that means you can use your brain power to do other things that you want to do. So if that is learn other parts of the job or learn more treatment ideas or whatever, it's just freeing up that brain space. So for me, when I was going through these initial years as a school-based therapist, I was just continuously making systems for myself because, like I said earlier, I'm like a puzzle person. So I was just like, how can I make this easier? How can I make it into a table, into a graph, so when it comes to note writing, for example, it's basically a 3-step process. It's like plug and play, right? Every single day. Boom, 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 boom. Those are the 3 things I need. I know exactly what I'm doing. It takes a lot less brain power. And if you really want to get into it, have you talked before about the amount of decisions that we make in a day?
I have the best story for you. So I don't think on this channel we have talked about it. So I will let you share a little bit about it, but afterwards I'm going to tell you like the best story.
Well, I mean, the basic concept, if you guys aren't sure what I'm talking about, is that we make, I don't know, thousands of decisions per day, and there is such a thing. There's always a name for things, right? Called decision fatigue. And by the end of the day, a prime example of this is, what am I going to have for dinner? God, I can't make one more decision. So the things like Steve Jobs, for example, wore the same outfit every day because that took a decision off his plate. Things like note writing and knowing exactly how to do it, creating systems like that, takes these decisions out of your day that free up brain power to do other things and grow in other ways that you want to grow. So that's my shtick on decision fatigue.
No, I love it. And it's you guys, really habits in anything, habits in our health, habits in our bedtime routine, which I'm consistently trying to get better at.
Aren't we all?
Habits in our work, like all of these things, like you don't want to be a robot. You still want to have some latitude to be able to, put your spice into it and have some variety and things like that, and adapt when you need to. But it really increases the efficiency. And again, our brains require energy, they require fuel, they require all of these things. And so if you can streamline things, it just becomes automatic, and then you don't have to put as much effort through it in order to do it. You don't have as much internal resistance, like every physical therapist ever knows the feeling where they're like, okay, I finally have a minute. Like, now I have to like write all of these notes, and you look down and you like for a second are like, oh my God, what did I even do with that kid?
Mm-hmm.
And usually you have notes, usually you have something to go off of, or you just like let your brain relax and then it will come to you. But that feeling of dread when you go to sit down to write your notes, and it could be because you're fatigued, but it also could be because you don't have a system in place where if you did, that resistance would be slightly less and you maybe wouldn't feel amazing. You're not sitting down and being like, I'm so excited to write my notes today. But it is easier and then takes less effort. By the way, my story is straight up that for like 3 years, I only wore gray V-necks like 100% of the time. They were all different clean gray V-necks. Never once did anyone ever ask like, hey, you only wear one shirt. Like, is that on purpose?
Nobody notices.
Now I got like a color consultation. So apparently light gray is not my best color. Apparently seafoam green is. Oh. But weirdly enough, now I'm having to spend more brain power trying to figure out my new wardrobe. And it requires more decisions, and I like it less, but it is getting slightly easier. Let's actually talk about who this course would be perfect for.
When I started creating it, or when I did create it, I thought it was just going to be for people like new grad getting into school-based therapy. What I have found since it has existed is, yes, those are some of the people, but a lot of it is people transitioning from other niches, and even people who have been a school-based therapist for years and years and years. I'm talking, somebody messaged me and she had been a therapist for 20 years in the schools and took my course and got something out of it, which was very humbling for me. That is not something that I expected at all. Honestly, I feel like it's anybody who is in the schools, who just wants to find a better way to do things or learn more.
I'm glad you hit on that, because I was gonna, after I asked that sneaky question, I was gonna add in that while I don't necessarily see myself going back into school-based therapy just because I really love what I'm doing now, with the military, you honestly just don't know. You don't know where you're gonna go next. You don't know what your opportunities are gonna be. And school-based therapy would probably be like what I would consider my second love currently. And if I did or were to find myself back in school-based therapy, I would want to take your course to up level my skills, because there are going to be things that you're really good at that I'm likely not going to be good at. And so I definitely want to fill some gaps there. I already know just by looking at your Instagram that creative intervention is like, you're like so good at it, and I'm like mediocre copycat. Okay, they put the cones here, and then, okay, yeah, like I could see how, that would be good for this kid and this kid and this kid, right? I'm like stealing games from OTs unsuspectingly. I'm like, I could use that and I could use that. But yeah, so even for pediatric physical therapists in the school-based setting who are just looking to improve their skills or level up their skills or see how other people do things in that same setting, because I don't think that there's a lot out there just on the logistics of school-based therapy. And it's such a needed space because A, the logistics could be different, but B, you're also getting other experts in. Like, didn't you have a vision therapist who I love vision therapy.
It's so cool. Oh my gosh. I created this course and I've been adding to it. So this time around, I added 4 new guest speakers, because essentially as school-based therapists, another one of the things that we do, aside from a lot of documentation, is I feel like we need to know little bits of a lot of things, and we don't really have time to explore those things. For example, pediatric pelvic health. I've seen a lot of kids with toileting issues in the school-based setting that I'm seeing on my caseload, but I have no idea, what do I
Well,
do
and
with that, you know?
it's really tough for the teachers too. So when you go
Yeah.
into the classroom and you're like, okay, we have a new IEP coming up. Let's collaborate on an adaptive goal. And they're like, toileting. They're like, this is taking up so much of my day and I don't know like how to make it better. This is definitely an area where I would like to focus. And you're like, okay, in schools, I feel like a lot of times school-based PTs, because it's a lot of times a really big mobility concern, that
Yeah.
the school-based PTs will take on more of that than maybe in like other settings where OTs may be a little bit more heavy-handed in some of those ADLs. Not that PTs don't, but just in the schools, I feel like I'm having a lot more toileting goals than OT is. OT is having a lot more fine motor handwriting goals.
That is like a prime example of like, okay, if a teacher were to ask me about that, honestly, prior to having Caitlin on, I wouldn't have known. I just kind of like push it off to the OT. Like, I know that pediatric pelvic health exists, but like, what does that mean for me? So that is one of the guest speakers that I just brought on, and she gave us so many good things about just even where to turn. Like, where's a good resource that I could show them? Who the heck could I refer them to? Things like that. And I have been slowly adding. The base course is really like the logistics that you were talking about, like note writing, annual reviews, scheduling, stuff that everybody does. And then I've just added things that have come up in my day that I find important. That I
So
think other people are finding important as well. I think we all place an emphasis on self-education and just being better for ourselves, which in turn makes us better for our kids, and that's what we're here to do.
just going down the sales page of your course, and again, I will link this in the description just for everybody to know they can purchase it at any time, right, Alyssa? You don't necessarily have an open and close enrollment time frame at this time, right?
No, I just did kind of like a live version where I was doing live recordings of those guest speakers. Occasionally, I will, kind of do a launch of sorts when I'm adding new content. But if you're finding this not during one of those times, you can still purchase it and get all the good things.
Which, can I just say thank you? Honestly, I love when people have evergreen courses, which for everyone, to evergreen just means that it's available for purchase anytime, because I'm like one of the only people who's like, no, like I want, like when I need the solution to the thing I have a problem to, like I want to buy it right now. Like, that's awesome that, you're going to have a big group join in January or March or February or whatever. But like, yes, it'd be cool to go through it with other people, but like, I need solutions now.
Right. Not always realistic. And honestly, people are coming into jobs not just during the start of the school year. So, and especially you mentioned traveling PT, they're changing all the time. So
all the time. Yeah. Okay. So if we go through here, we've got you being all cute and stuff, a little bit about you. This is kind of sharing a little bit more about the course. And then, yeah, ooh, and you do lifetime access too. So let's talk a little bit about that, because what if someone buys it outside of that live launch, but then you have a live launch later? Like, what do those people get access to that information? How does that work?
Absolutely. Just gets dumped right into the course.
Awesome. And then if you have like a live call, like the one we did, they're like notified, or it's, if they're, it's posted in, do you have a Facebook group or like a?
Yep. There's a Facebook group specifically for the Ultimate Guide to School-Based PT course members.
Cool. So then, and then that's always really nice too, because you actually get to you are speaking the same language. They're like, oh, in module 3, I got confused at 15-minute mark when they were talking about XYZ. And then someone else who's literally watched that same part of that same video can be like, oh, I think this is what was going on here. And then you can pop in and be like, yep, like that's totally right. Or, there's a couple different ways you can look at it, which I feel like seems to be the answer a lot of times. But
always, it depends, right? Some of these Facebook groups can get so big and can be overwhelming for people. And, I've found some people like don't even want to ask because people can be kind of mean. Like, how could you not know that? Like, blah, 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 blah. One of my goals with the specific course member Facebook group was to create a more safe space to feel okay asking these questions that you might not know. And it's okay that you don't know because we can't know everything. So
no, and just think of it this way too, you guys. Like, it does take a lot of courage to ask any type of a question, but the truth is, if you don't ask it, you're missing out on opportunity to get an answer or a solution. And so, what if that answer saved you tons and tons of time? So it's definitely worth the uncomfortableness. We all feel it. Even getting on interviews sometimes is nerve-wracking for us still. So there are going to be different things in your life that make things feel a little bit uncomfortable, but just think of it as growing your courage muscle. And I love that Alyssa has created a safe place where then that becomes a lot easier, so you don't have to think about it as much.
Well, and I tell them too, if you have the question, somebody else is sure to have the question. So ask it, and then everybody can get the answer.
Ooh, what is that? Fancy calendars. I love it.
Those were created in COVID times.
Oh, yeah, totally. Ooh, even the 18 most commonly used signs. I used, even for kiddos who aren't fully signing, it gives them a context, right, of what you're asking them to do, because they may not fully grasp it, but they're like, oh, okay. If you're giving them those visual cues, that can be really helpful. Ooh, I'm really into this 29 questions asking your school-based job interview. Look at all this good stuff, guys. I love it. Okay, cool. So then these are the current prices and people who just register now, and then you got a little bit of a fact sheet. So, and here's the other thing too. I always like to talk about money because I feel like people don't a lot of times. Well, sometimes, paying a big chunk of money can feel intimidating, especially if you're a new grad and you have student loan payments. Look at it as an investment in how much time and energy you are going to save having these skills. And these skills are very specific to your setting, where these are things you're going to do every single day. This is not just one treatment technique for one type of patient population that you may or may not see in the schools district that year. This is something that you're literally going to use every single day for the entirety of the time that you're in school-based therapy. So I think if we look at what our hourly rate is too, so maybe, it's $40, $50 an hour, I don't know, $60 an hour maybe if you contract yourself, which is a thing you can do in some states, by the way. There is a way to calculate how much time you're saving. So even if you take off 30 minutes a day with these systems in paperwork and efficiency, okay, that's a huge amount of time over the week, over the month, over the year. Calculate that up and realize okay, if I'm making my job easier, all of a sudden this investment is a piece of cake.
It's a no-brainer.
Absolutely.
You nailed it.
I love it. Is there anything else that we have not gotten to about your course, Alyssa?
I will say that sales page I haven't even updated with all the stuff that I just added. That is going to be IEP Mindset with Dr. Lauren here. We did healthy toileting habits with Dr. Caitlin from Unconstipated Kids. Lauren mentioned I had a functional vision therapist on. which was very cool. And then I also had a teacher on because I wanted the down and dirty, like, okay, what are your stressors during the day? What am I missing when I walk into your classroom? How can I try and better navigate that to make both our lives easier? And also, how can I better explain what the heck we do so that you are happy when I come into your room?
Yeah.
Um, so
Yeah.
that's kind of where that discussion went.
Well, and I just love bringing up the teacher component because we are interrupting them. We're disrupting their flow. All of a sudden, like, even if it's pre-planned, like, they're not always thinking about us, right?
Mhm.
Maybe they were like, oh shoot, I needed Johnny for this one group, and oh yeah, I forgot he had PT that one day this week, when I was making my lesson planning. And so then she has to change her plan, right? So how can we be extra respectful of their time, their energy, their resources, and then also really help them fill in the gaps and see, okay, this is how Johnny is moving, and these are easy, low stress tweaks that you can make, and how he sits or how he moves, or, you know, a movement break to help you have a, you know, smoother classroom experience, because the happier kids are and the more they can move, the happier they are, and the more they can pay attention, and the better their postural control is, the more their brain can work. But also so that I can help you understand all of these little pieces while not requesting too much of you.
Yeah, and I think we talked about too, like how they don't exactly know what we do. So that is actually why I created the school-based PT brochure, is to just try and like quickly help a teacher know, okay, this is what a school-based therapist does. This is how they can help. These are some things to look out for, and help them realize that like we're not just taking Johnny out of social studies and he's going to miss that content. What we're actually doing is like much deeper than that, right? Like we're helping Johnny be able to sit in his chair. If he can't sit in his chair, then he's using his brain power to sit in the chair, not focus on what you're doing. So we're actually helping you, but how can we help you to know that, right? So,
And see value in it. I think that's the
yeah,
hard part, is like, we don't want to add more to their plate, but we do
right.
want to have the power and the knowledge and the words that we can help them see the value in what we do. And also, honestly, sometimes for like a new special education teacher, all that equipment can be really overwhelming. So, okay, like, how can I help you feel comfortable and confident in putting Johnny in his stander throughout the day, every day, so that we can get these benefits, and so you can see exactly how it ties into his school day and his academics, and your goals for him, but also my goals for him too, because they're all very intertwined. Even if you're in a district that has separate goals, like, they're still intertwined and can't really be pulled apart. I'll put the link to this brochure in the description, so it's super easy for you guys to have access to it. You are doing such good stuff in the Instagram space.
Oh, thank you.
So this is Alyssa's Instagram, Move to Learn PT. Again, will be linked in the description. But she is super fun. I feel like you're a pro at reels and just like, ooh, therapy bag items. I haven't seen that one yet. I feel like I saw your Target dollar spot stuff. I really like just how you do like different theme stuff, or just different types of activities, and how you like put them together so that they make sense. Like, your superpower, and like one of your superpowers, I'm sure you have many, is to have specific like exercise and equipment, but like globally it makes sense both to the therapist and all the nuances, but I think also probably to the kiddos, because I think sometimes we have them do things and they're like, why am I doing this? I'll do it because you asked me, but like,
We do
So,
lots of games and
I don't know why. I feel like it was because you used fun colors. Because it's not like I've never seen this activity before, right? But there was just like something about it where I was like, oh, this is fun to look at. I bet it's fun for kids to look at because it has just different colors. And so, just different, like, easy ways to do certain activities that other therapists are utilizing that maybe you're not or haven't thought of in that manner. I feel like such good stuff. Or honestly, if you're just like looking for equipment ideas, you're like, my school gave me a budget. I get to buy something this year. I need to go on Amazon. These
I should make a list, an Amazon list. I really should.
You should have that as like your download, like another download or a blog post or something.
There's just so much. I think it's funny you say like that's my superpower because it is really true. Like I don't even post 20th of what I do. I'm very much the therapist that just comes in the room and sees something that sparks my interest, and then I just use that. I use it for however I need it for that kid. So that's just like how my brain works. But I'm
Yeah.
glad that other people get value from it.
It is not how my brain works, so I appreciate that. Okay, so we've got your Instagram and we've got your course. Your website, if anyone just like wants like everything all in one place, or they're like, hey, this Dr. Alyssa is really cool. I want to stalk her, see what else she has going on. Professionally stalk so I can learn from you. Not creepy stalk.
Please don't do that.
It's movetolearnpt.com. Again, we'll link that all below. Yeah, will you just tell us a little bit about your website and kind of what other things you might have going on?
I am a very creative being. I can't stop creating. I feel like that's something that you and I have got in common, Lauren. So it kind of started with the course and then just went from there. I do a lot of things because people ask me to, and then I say, well, I guess that's the universe telling me I need to go start treating infants. So that's kind of what happened. But the connection here and why you're seeing, direct treatment and milestone consultation is that these kiddos that I was seeing in the schools, a lot of the time when I was able to talk to their parents, they were not meeting milestones as an infant. I implore you, school-based therapists, look at your caseloads heads. How many flat heads do you see on your caseload? I'd venture to say it's more than you expect. I would say a good 50% of my caseload right now. And I haven't even dove into like unresolved torticollis and all of these things. All of this to say there is a very strong link and a gap in access to infant gross motor wellness and development. The Instagram space is starting to see all this information kind of explode, which is amazing. But there just needs to be more and more and more of it, in my opinion, because then I'm seeing it in the schools. I'm seeing it in the elementary, middle, and high school, and it's affecting their academics. And could this have been prevented if they just knew the information? That is kind of where my passion kind of shifted and why I'm now seeing kids on the side and doing kind of baby stuff, because there is a huge gap, and I want to kind of make it all come together for these parents. And I feel like I have a very unique perspective coming from the schools and seeing like what could happen.
Yes, there's a part of your website that I loved. So everyone who has been on this channel before knows that I'm obsessed with educating parents and having individuals be as proactive as possible. And it's so interesting, but I've never heard anyone use the term preventable motor delays. And that's exactly what a lot of things are. Now, if you have a neurological diagnosis, or you have a genetic condition, or you have a traumatic birth event, there are going to be things that this part of the conversation are not necessarily going to pertain to. There are limitations when there's neurological damage, absolutely. But there's also this huge other part of the population where we just have a knowledge gap, and we have a proactive gap, and we have a confidence gap a lot of times, and we also have a marketing block, I would say, a lot of times, because a lot, like the baby industry from a capitalistic sense, does not always have the same goals as the pediatric physical therapists who want you to have optimal movement. So a lot of things that could impact like preventable motor delays are things like containers, baby jumpers, the baby walkers that you actually sit in and then they walk their feet, not the push walkers. Push walkers, 2 thumbs up. Baby sit-in walkers where they walk like this, no thank you. But there are things like that even to this day I still have like people texting me and say, hey, like I have a baby, I know you're a pediatric physical therapist, like I want to buy safe things that are moderately priced that I know I'll get a lot of use out of. What do you think? And my go-to response is always like, babies on the floor is going to be your best. Playpen / like a baby gated area where they can be safe from dogs and things like that, or other, small children.
What I like to call this is a yes space.
Ooh,
a baby you can put, and everything is a yes. There's not like a safety issue there. Your animal isn't going to get in there. Your toddler isn't going to get in there. You can set them there essentially like a container, which is I think why moms go to these things, because it's a safe place that you can put them and nothing's going to happen, right? Create that, but on the floor. So wherever you can do that in your house. I'm looking over here because I
have
do
a
it over
safe
there.
Space.
Yeah. I have a yes space
your
over
yes
there.
space is over there.
Yes. That is one of my main, like, let's not use containers. Let's create a container that is good for gross motor development, but also safe.
Yes. And then, other things that you mentioned here are things like optimal function and optimal movement. I think a lot of times that's like something that is only just being talked about, is we've only ever been talking about as pediatric physical therapists is delays, is basically treating a problem after it's already a problem, or treating kiddos who have significant impairments who need us like immediately, which absolutely love that population. They obviously really need us and they need a lot of support. There's another group who could, with a little bit of support, they don't even need a lot of support, just a little bit of appropriate access to pediatric physical therapists and this knowledge base and some confidence and handling skills and learning like, okay, this is where I put my hand and this is what I'm looking for. And when my baby cries, it's okay. I just, do this instead, or we just let him roll out of it and then we try again, or we try a different toy.
Or this is why, or like, this is why they're crying. This is why they're doing this thing. I think that's part of what's missing too. I wanted to mention too, why I like the phrase preventable motor delay is because very often, this is going back to a school thing, right? Is that I just get their diagnosis is simply developmental delay. And that is 80% of what I end up seeing in the schools, is that they're just developmentally delayed. But like I said earlier, I believe, it is my thought, that if they had access to these things as an infant, maybe they wouldn't be where they are.
Mhm.
because now I'm trying to do all these things. Now I'm getting the 8-year-old back on the floor in these functional play positions because he never experienced them.
Right, right. On hands and knees so that they can strengthen the intrinsic hand muscle, so that they can hold the pencil, so that they can control the pencil, so that they can write the name, so that they can form the letters, so that they can copy from the board, so that they can learn the information, so that they can eventually pass the test.
I mean, but like that's like the whole point, right? Is like, okay, if they're crawling now, they're learning reciprocation of the lower extremity, and maybe they didn't know that, and they've been doing a step 2 pattern on the stairs. So
Yes.
it's just all connected.
All
We know
connected.
that. We
Crossing
know
midline
that.
from, but
Yeah.
honestly, crossing midline from when they're babies. So
Yes.
this is something that, again, to pull it back into school based, but also connected to infants, is a lot of kiddos that I saw in the schools really struggled with crossing midline. For people who don't know, crossing midline is when you have both your hands on one side of the body. So it requires trunk rotation, but also requires this hand to go to the right. And to meet my right hand. So my left hand has to meet my right hand on the same side of my body. I feel like that was overly complicated. Anyways, a lot of kiddos will transfer objects in the middle. So this is midline. They won't cross midline to bring both their hands over here. They will meet at midline where the object is on both sides of midline, and then they don't have to cross midline.
Or they come to midline and then turn their trunk, which is cheating.
Ooh, is
Because
cheating.
my hand is still at midline.
Yeah.
It's still at midline at my trunk.
Ooh, ooh, ooh. You want to know what I did back in the day? They thought I had a vision issue. And turns out I would write with my head down on the desk like this. Sorry, I deleted you. But if my paper is here and my head is here, when I'm writing, I never have to cross midline.
Oh.
So everyone thought that I had vision issues. And so when I was little, they were like, Lauren, can you not see the paper? And I was like, nope, I can see the paper just fine. They were like, okay, hold your head up. And I was like, no, thanks. And they were like,
How
why?
interesting. Yeah.
And I was like, because it's easier, because it feels good to my body. Well, why does it feel good to my body? And so they're like, obviously I'm an independent adult, but there are also, things that were difficult for me as a kid that maybe could have not been difficult. And so I think when we're looking at optimal movement, it's about, could we, with the information we have and the skill sets we have and the things that are available to us, actually influence our child's lives so that their experience is easier? If yes, then we should do it, within reason.
And for these kiddos in school is a huge part of your life. So to be able to make that easier is, you're going to have quite the impact on these kids.
Well, Alyssa, do you have anything else you would love to tell the humans of YouTube?
I feel like I could talk forever about school-based therapy. So, I mean, really just PT in general. One of the things I love about being a PT is that there is just so much, even within each of these niches. Like, there is nothing to be bored with in this profession, and that excites me. So, if you have any questions, please ask. I will chat for hours.
Well, and the other thing too that I would love to just pay mind to is that in the world of physical therapy and in the world of pediatric physical therapy, we don't see a ton of physical therapists with online courses yet. And I think that's something that has such a value in the marketplace, not just for physical therapist to physical therapist courses, but physical therapist to parent courses, physical therapist to teacher courses, other type of educator courses, things like that. And so even just by being in Alyssa's circle or taking her course, you're getting a step closer to someone who's already done something, if you even have an inkling of wanting to potentially do that yourself, right? So there is always a path forward, whether no one has done it before, but it's so much more fun when you're like, hey, Teach, I see you a couple 100 yards down the path. Like, is it as scary as it kind of seems? And she can be like, yeah, like there are some parts that are difficult. There are going to be things you don't know how to do, but it is so worth it. It is so needed. It is another source of income. It is all of these other things that by investing in this course, you're going to get that maybe you wouldn't even realize at the time, but like a year or two down the road, you're going to be like, oh, I wonder if I can make a course because I saw her do it and I bought it and I thought it was great. And
the answer is yes, you can.
Right? And, you would have her email. And so, maybe by then she'll have a course on how to do a PT course. Who knows, right? Like, or she might know of someone else who does have a course about that because she's done it already, right? So there's a lot of potential, I think, here, even more so than just learning the content, even though the content itself is super valuable.
Oh, you just really know how to build people up, Lauren. Oh my gosh.
It's because I didn't have any friends when I was growing up. They all moved away. And I was like, I'm going to have friends in real life. I'm going to master this. And
yeah,
I just love you guys so much. Like, I just have so much fun on these.
I know. Find your people. If there's anything you get out of this one, it is find your group and join our group. I mean, we're certainly not excluding anyone. We want everybody to join because it is so exciting.
But yeah, like we're not that much further on the journey than you are right now. And whatever your next step is, definitely take that, keep the focus on your next step. But just know that if you ever wanted to do what we're doing, that is totally possible for you. We're here to help in any way that we can. And just high five for being in this profession and for trying to learn as much as you can so that you can be the best PT that you can be while still also feeling like you're a totally sane human on the inside. That's important too.
Preach.
Awesome. Well, Alyssa, thank you so much for joining us on the YouTube channel. Is there anything else you would like to say to our friends?
Lauren, you got to stop asking me that. I'm going to keep talking. No, we'll stop it here for tonight.
Awesome. Well, Alyssa, thank you so much for joining us, and we will definitely have you back. Bye.
Okay, can't wait.